funny looking house, the Buckminster Fuller House. It was sort of on the side of High Street on the east. There was a big yard there. It used to be Professor Hoag's old field
Dr. Burton.
where he had his home,
Okay, okay.
but it's all grown up now. Needles, syringes. I kept some bees back there for Charlie Jessup, which was. And I would have to go carefully through the weeds to get to it. The bees.
We just lost a bee, my grandson, my son-in-law
Oh.
and grandson have two hives, and we just lost one.
It's really hard.
I know,
These days.
They've lost several before.
Usually they go in the winter, but, it can happen any time with all the darn mites and hive beetles and varroa and
Well,
Steve was early.
typically.
I was even a student. I walked down to his school and somebody was there and he let me in.
So,
All right, since everyone is here, and we are, apparently. I'm going to call the August 15th, 2024 meeting of the Monroe County Board of Health to order. First thing is, Lori, I think you have something you want to add to the agenda.
Yes, I'd like to add an item under new business. So this will be a vote on a new conditional agreement for employment for an internal candidate.
And Lori will explain all that when we get there. Forgot a parent. Okay, everybody have a chance to read the meeting of the previous, or minutes of the meeting previous month. And if you did, do I hear a motion for approval, or are there additions or corrections?
Make a motion that we approve as written. Second.
It's been moved and seconded to approve the meeting, the minutes of the previous meeting. All those in favor, please say aye.
Aye.
Opposed?
I would just like to say what a good job Linnea is doing with
Yeah.
minutes.
Yeah.
They're very concise, but have enough detail.
Excellent.
Great, thank you for that. Next item in our agenda is public comment. We have any members of the public would like to make comments? No? Okay, then we'll move to the next department updates. Public health.
So I have invited Michelle Matern. She is she works for the Indiana Department of Health, the regional administrator, and she's just going to provide a brief overview of the HII funding, which will help to give some additional information for the updates I'll be providing.
Can you hear me okay?
I think we can hear you.
Yep, we can hear
Okay,
you.
perfect. Sorry. I said my mic was disabled in the beginning, so I just wanted to make sure you guys could hear me. So thank you so much for inviting me, Lori. So as Lori said, my name is Michelle Matern. I'm the Southern Regional Director. So I probably met some of you there when we were with Dr. Weaver for her county tour in Monroe. So thank you so much for having me. Lori asked me to come on and just to talk about Health First Indiana, and I think specifically just about partnerships and core services. I think Lori and I and Dr. Britton met with your auditor and talked a little bit about how we have a lot of counties asking right now about, what Health First Indiana funds can be spent on, because counties are getting ready to enter through that budget process at the local level. And so the main thing with Health First Indiana to be compliant with the Indiana code is that all Health First Indiana funds are spent on core services, whether that's an employee delivering the core services, whether it's supplies or equipment to deliver those core services. The main thing being that it's tied back to core services. And then, as you probably know, Lori has to rely any kind of data or information collected into our activity tracker twice a year. And that's also a requirement to be compliant with Indiana code and Health First Indiana. And so Lori has requested a summary of those that she's entered, and we're working on that report for you, Lori, hopefully to get it back to you tomorrow or next week. But you guys are doing a lot of great things, showing a lot of great partnerships. And I know with some of the partnerships that Lori and I discussed earlier this week, there's really a wide range of how counties decide to do partnerships within their communities. So some have a grant application, like an RFP that they put out once or twice a year, and have organizations apply that meet criteria within the core services, or if there's a certain core service that you feel like your local health department is not providing, you can open up that opportunity to community partners, or you can expand internally to meet those core services as well. You could also, just depending on what you decide locally, if you want to distribute that money after that organization has provided those services, like an invoicing type of model, like we do frequently with our grants here at IDOH, or if you do it with an upfront lump sum and just require things within the contract or MOU. We do have a contract guide if that's of interest. I think I've shared that before if it's on the SharePoint site, Lori, but we always encourage you to work with your local attorneys. We have a regional attorney on our IDOH staff, so if your attorney has questions, they can kind of talk peer to peer, and that seems to be pretty helpful sometimes to local health departments as well. But just the overall, going back to compliance of Health First Indiana would just be that you use Health First Indiana money for core services and delivery of core services, and then reporting the data that those partnerships have. So happy to take any questions or answer any clarification that anything I just talked about. Lori, did I miss anything that we talked about earlier?
No, I think that was great. Thank you.
Okay. Yeah.
Yeah. Oh, okay.
All right, well, thank you very much for being here.
Thank you guys for having me. Yeah.
See ya. Hey, Mike.
How's it going?
Good. Didn't have a chance to say hi earlier. It's kind of rushing in, so.
We got you in here.
Yeah, we did, yeah. So welcome and looking forward to your report, environmental health services.
For general environmental, a lot of radon requests have come in from last Friday. About 14 came in from Friday to Monday, about 14 came in, and Cody and Simeon are working on that. For foods, we're focusing on getting school inspections completed within the month, and then also finalizing our farmer market inspections. And then wastewater, they're just focusing on new installations. And then also, I don't know if now's a good time for the ARPA funds to speak about that, but Monroe County government is going to be using ARPA funds to assist with septic repairs. First, it's going to start with getting your site plan approved, your soil reports, and also your specs in. And as long as that's in, then we'll speak with the installers that's going to be putting in doing the installations. And as long as the property owners gets 2 quotes, Monroe County government will pick the best quote to move forward with the installation, and the Monroe County government will use the ARPA funds to help pay for that septic installation.
Do we have any idea like how many properties that might include?
I mean, if it needs repair, they're technically able to use the ARPA funds, but as of right now, there is 1 site approved to use the ARPA funds, and then there's 3 other sites with the plans approved, but without the quotes in yet. And after that, there's about 3 to 4 others that are in queue to get site plans and to get approval as well.
So we know about at least 8 properties.
I'd say a lot more than 8 properties at this time. So yeah.
Yeah. Do we have any idea, just in general?
A ballpark number, I would say there's probably at least 20 sites out there that could use like the ARPA funds for the repair. So,
And,
but that's probably, I'll tell you, that's probably on the low end, but I don't want to aim too high.
and is there any requirement in terms of actual funding? You know, do they have to meet certain financial criteria in order to qualify?
As of right now, you just need the 2 quotes
Okay,
from an installer.
and nothing,
And then also the repair, you need your permit. So
okay, but we're not requiring anything.
not at this time though.
Excellent, thank you.
And that's all the updates I have for EHS. So
Any other
if
questions?
anybody has questions. Yeah.
I do.
Yeah.
And that is there any requirement when a new property is being developed for multiple homes for radon that the actual developer has to do radon testing when those properties are put in place?
If it's a basement going in, I don't know if there's any requirements, but it's recommended if a basement's going in.
Okay, but if it's on a slab, there's no requirement that,
Not that I'm aware of.
thanks.
You're welcome.
Thank you.
You're welcome.
I suppose it would be difficult till the construction was finished, basement floor poured. It would be difficult maybe to get a measurement in there.
There's a radon map for the Monroe County government,
Well, yeah.
like a certain, what levels are around Monroe County.
But it varies from one property to another.
It's very like site ordinance.
Yeah.
Like site specific, yeah.
I just didn't know if, when someone went in and bought their new home, whether that developer would have to have actually done radon testing of that home before they sold it.
Like when I was buying my property in Monroe County, like we got like a site inspection, like checks, with like if there's cracks, if the radon's working and whatnot. But I know now like people are like rushed into like buying homes and sometimes that's like skipped over. So I hear that that's pretty common now, unfortunately.
Thank you.
You're welcome.
At least mitigation typically isn't an outrageous amount of money. Let's say.
Mine was pretty reasonable, I thought.
Well, yeah, that's what I mean. It's not an outrageous amount of money.
But if you
Typically,
don't have the money,
well,
you
yes,
just put it
well,
all
it's
for this
true.
brand new home,
That-
and suddenly you find out that you've got this health risk.
But the Monroe County Health Department will do that radon check though.
They'll
So,
do the
you
check,
can-
but they won't do the
Yes,
mitigation.
we
So,
can assist with that, like be a little helpful with that, so.
and we're very grateful that Monroe County actually has radon testing again.
It's a good program.
Great. Thank you, Mike.
You're welcome.
Lori, admin?
Yes. Did we skip over Lindsay? I do have some information for Lindsay's I can share. Okay. So I'll go over Lindsay's, just give a brief kind of overview of what they had going on. So they've done several outreach events. They've offered some immunizations, performing some blood pressure screenings, A1C checks in the community, administered, diabetes education at the Church of Jesus Christ, and hosted a back to school immunization clinic on August 10th. Upcoming outreach events, they're doing more blood pressure screenings and diabetes screenings, healing hands at Mother Hubbard's Cupboard and the Woodhaven Christian Church. We are still waiting for the updated COVID vaccines, and when to expect shipment for those. They have received their first shipments of the flu vaccines. Let's see. Currently less than 5 open cases of children with significantly elevated blood lead levels. And they are offering free finger stick lead testing for children under 7 years of age. And then, yes, planning their fall vaccination clinics at MCCSC schools, RBB, the nursing homes and shelters. Moving on to health department updates. So currently we have each division working on their key performance indicators that will be due to the Indiana Department of Health by December 1st. So this will be aligned with those core service requirements, how we plan to measure success in 2025. To give additional information about the meeting with Michelle Matern, who was just on here in the auditor's office. So that was related to, we had funding coming out of 1161, which is our Health First Indiana funds, for self-insurance for positions that are vacant and new positions that have not received that final approval. So essentially to get into compliance, we've had to switch money out of the county health fund, return it to Health First Indiana, and moving forward, all of the insurance will be coming out of the local county fund. So essentially it was, the funds were being pulled out because there wasn't actually an employee in those positions performing the core services. So that's kind of our solution for this year and then moving forward in 2025. Still waiting on an estimated time frame for those job descriptions and the new positions that are offered with. Hoping to receive some feedback in September, but no word on that as of right now. We have,
One of them's coming back by September 3rd.
oh, one of them.
Yeah, the
Okay,
Director of Clinical Services. They said yesterday in that meeting, September 3rd.
very good. We have a new hire, Haley Hayden recently began as a level 1 DIS. She's working part-time, doing all of her training, and that is going well. We have an offer submitted for the wastewater sanitarian, and interviews are currently being held for the senior foods position and the harm reduction position. Indiana is now requiring all schools to have staff trained on Stop the Bleed. Christina, who was in our emergency preparedness coordinator, and she's now moved into the behavioral health and wellness position, is certified to provide those trainings in the schools, and she's starting to set those up. And that's really all I had, trying to keep it brief.
Or did we hear anything from PAC about the maternal child position?
No, not yet. It's at WIS as well.
That whiz.
Thank you,
I'm wistful.
thank you.
Thanks, Lori. Yeah. So we're gonna go ahead and move into old business, the IU Public Health Clinic contract. Y'all have a copy of it, I believe. Big contract here.
So looks like we have 2016, 2018,
So,
and 2024. Thank you, Lori. Lori, are you familiar enough with this to just tell the board very quickly? Is the rate breakdown the same for all 3 years? It's still the 80-20?
Yes.
Okay. So I think that was, I mean, unless people have read it and they have a question about the services, I think that was the only thing. Do we need to let somebody else? Yeah. I think the concern we had, or the question, or what we wanted to discuss, was the reimbursement breakdown.
yeah, I think you're having a hard time hearing it. Are you having difficulty hearing?
No,
No, okay, I'm sorry.
I'm just wondering if somebody historically who was around in 2016 knows why it became this particular 80-20 breakdown.
And we're looking at Kay and George.
Yeah,
Well, I was here too, so.
Oh, okay.
Okay.
All three of
I mean,
you.
we go back a long way.
I didn't know. I don't think we ever knew. And
I'm guessing this is something Penny did, just like did it. right?
Maybe they looked at the number of cases or work that was being done at that time or so. I don't know how they came up with 80.
I don't recall ever having a discussion
It
about
was
the.
never raised as an issue as far as I remember.
Thank you for raising it, Lisa.
So so, I mean, is there some kind of, report we can get as to, amounts of money spent on vaccines versus, I mean, is there a profit on this process at all or not? I don't, it's hard to tell from the.
Yeah, I'm actually a little fuzzy on what the breakdown of what we're paying for, what we're not paying for. Why is it 80-20?
Mhm.
Why should it be 20-80 or, you know?
So, okay, we could run some reports on, just VaxCare, what we've gotten in total for reimbursements, over the past couple of years, and then that 80% that's, paid directly to IU Health versus the 20%. So the 20% that, I mean, essentially we're putting our 20% back in to be able to be spent kind of out to keep that going. I don't have those numbers with me today.
And
As-
are they doing 80% of the work?
That's nothing.
Yeah, yes, that's exactly what, see, I don't understand this breakdown and I don't understand what they're getting, what we're getting.
Really, I think it had to do with COVID, but
But it goes back to 2016.
Yeah, this is way
At
before.
I
least.
mean, the contract is $222,000.
So that's the
Well,
other,
I think that's, yes, so I think that that's part of it, the question that arises, we're paying them for the services, and then the grant funds are passed through, so the grant funds 100% kind of support that as well. So I don't know if this is just supplemental.
So maybe
okay,
if we could get a better idea, probably from some fiscal person at IU Health, because I don't think the folks that work there doing direct service are gonna know this, but if we could get a sense of if it's split that way, because even with our 222,000 that we put in and are taking the 20% of the insurance reimbursements, their 80% only just allows them to break even, or something like that. I mean, that's really the question we need to answer, right? Is how's that going? How's that going?
Well,
That
what was your,
breakdown.
So the
basically, when
other-
you brought this up initially, you seemed fairly certain that should be actually, we should be getting the 80 and they should be getting the 20.
our tour, I mean, we purchased the refrigerators. I mean, I know that's not the whole thing, but we purchased that equipment, so that's something that the health department paid for. I think, I don't know which, are our people there also administering vaccines, or we have people who could administer vaccines? Is that true? We employ folks who could do that, or not?
Well, Christina technically could in her new position, but otherwise we don't have
We don't
standard.
have-
But that's why then they fall under this
Cause that's why we
contract
have the contract.
Right,
as one of their
Because
services.
personnel,
We'd have to do it ourselves. and-
so basically we're paying for the personnel. Is that what I'm hearing?
but there's some sort of reimbursement, I assume, for the vaccines. It's just not clear. I would like to see an analysis of the VaxCare scenario and what funds are getting passed through and what, if, what the numbers look like, so we can actually make a decision as to whether, when we approve a 2024 contract, then, we know what the numbers look like and make sure it makes sense to not change the numbers.
Well, it would be 2025. So when?
Well, no, because this contract we're voting on is for 2024, right? It's not been signed, is that correct?
Oh, we have a current contract
Well,
for this
yeah.
year.
It goes through the end of the year.
Okay,
That's probably
So-
the official.
So
I got you. Okay, so it wasn't signed, so I wasn't sure. I got you.
when we go to renew, do they provide any information to you? Like, here's what, like, if we're gonna ask for an increase over the 222 for 2025, here's our budget. Do they give you any of that, or is it just a rubber stamp like, okay, it's 2025, we're gonna renew your contract? That's the amount.
I get an Excel spreadsheet for a budget that kind of breaks out like the contract, the employees, the grant funds, kind of how they're gonna plug that in. So I have that information, but we don't get any reports on like where those funds have gone, which I think kind of touches back a little bit to like what Michelle was saying, of like doing those like checks and balances.
I'm,
I mean, how many, basically, the other question I would have for them is, how many FTs does it take to administer vaccines? I mean, do they need one full-time person? And that might be multiple people, but a full-time person that administers vaccines? Because I can't believe that someone isn't doing other stuff and that we're not paying for their employees who are doing a lot of other work and accidentally give a vaccine now and again.
So Lindsay, they don't have any 1.0s from my understanding, Lindsay's like a 0.75, and then they have some 0.6, they have some 0.2 PRNs. Again, you'll be able to see that once I can send the Excel sheet that kind of shows that breakdown.
So
Um,
ideally, in a perfect world, we would have all kinds of time at our disposal. And we could say, I'm serious, we have to prioritize what fish we're gonna fry here. And I do think it's important for us to understand the 80-20 and their whole budget and how, you know, how much of it is our funds and how much I'm not saying it's not important. I'm saying, holy cow, if we ask you to look into this, to set up a meeting with the fiscal person to get all that, then we're gonna have to ask a board member to, you know, work with you and understand it and explain it to us. And we have pressing emergency issues to deal with, not to mention all those positions. So I don't know what to do with this.
Well, I just think we need more information to approve a contract, so, because it will suddenly be ready to be approved for 2025,
Exactly.
and we need more information, and so it's August, so we still have some time. So I would ask that we have some sort of data for this VaxCare and understand the numbers.
there's someone who works with finance and budget. I could reach out to her.
Thank you.
For what it's worth, the encounters average out at about 15 per day for immunization at Miller Drive and Health Beaches.
That's a lot of people. To me, that's a fair number, especially when you're driving, you know, from Miller Drive to an outreach event.
Well, it's pretty constant, right across this 2 quarters reported already for 224.
Right. So that sounds,
Well,
that
thank
sounds
you.
like a full-time position, maybe, I don't know, 15. But, you know, it's not just a matter of going in and jabbing somebody. It's a little more to it than
I
that.
don't know.
All right, so any more comments about the IU contract? At this point, the IU Public Health Clinic contract. Now we're gonna talk about the IU School Liaison contract.
Yes. So again, just following up, and because this, we renewed 6 months, July to the end of this year, so wanted to start the discussion now, about this. So let's see. So looking at changing the way the contract is, again, to ensure that we are in compliance with Health First Indiana. One of the suggestions, or one of the scenarios that Michelle and I talked through, was outlining it based upon very specific core services. So this could be maybe assisting with immunization outreach clinics that they're doing in the schools. It could be conducting stop the bleed trainings in the schools, naloxone training and distribution, but setting it up so, again, we know that we are funding specific core service areas and then getting the data back on that. So I think originally the thought was that Lisa would be the health department school liaison, but that's not really fitting this scenario here, because she's still an IU Health employee and still splitting her time on IU Health initiatives and overseeing the IU Health school programs in 3 other counties. So I think that that's one discussion of changing our contract so that we can make sure that we're in compliance with the state. Part 2 of that, I think that we should consider also bringing back a health department school liaison. We have a lot of schools in the area. We've gotten some feedback from additional services being requested. The 3 surrounding counties that have IU Health, Owen, Morgan, and Lawrence, have an IU health school coordinator and a local health department school liaison. So it makes me wonder if we are underserving our schools by not filling that school liaison position and considering that as well.
It's hard for me to understand how there would be enough work for both positions. Maybe I don't understand.
Well,
And then
Isn't the-
duplicating.
isn't the school liaison for IU covering several areas? She's covering, did I read that correctly?
Yes, so she's overseeing the IU programs in Morgan, Lawrence, and Owen counties. And then the Monroe County. And then acting as our, doing our school services.
So how would it not be duplicative?
Well, I think it would be, they would be collaborating and serving all of our schools. I don't think it would, I think they'd kind of be splitting that workload up.
Is there some way to assess as to whether the schools feel that they're now currently not getting adequate service from the school liaison, even though she is covering what, 3 counties? Is it 3? I mean, obviously she's not spending 100% of her time here. And she can't, I mean, physically couldn't do that in Monroe County. I'm sorry, you know.
Yes, so
But if the schools feel that they're being adequately served, then it would probably be a duplication, or there may be things that we could add.
If you look at this little, whatever it is here, it says one school has put down they would like additional educational support. But the rest of them are saying no. On that,
But when you get to what other
Are you talking about the
initiatives,
list?
it's like professional development for nursing staff. I see that a number of times. And
that's not the role of, I don't know.
and the funniest one for me was we want grant and resources for a playground and health office equipment. I was like, what do you want the liaison to do for you? What? So, would we be duplicating services if liaison is doing the Stop the Bleed?
she refers that out to the IU trauma team.
Lori, you said that there were requests for additional help from some schools, all the schools. What were those? And many?
So Project School in Clear Creek Christian requested additional educational support. St. Charles, Clear Creek and Project School requested emergency preparedness training. Bloomington Montessori and Covenant, for assistance with dental screenings. Montessori with, vision and hearing screenings.
I don't think there's a need. Or it felt need.
Or maybe if it's part-time, I mean, I'm not sure.
It's this blue thing. Must be something of a certain.
I looked at this online and I had.
It's toward the back.
So is there a contract to look at? Right, I'm trying to.
Oh,
Is
the
this-
current contract, is,
Mhm.
we do have a current contract, it might just not be in here. I can send, that, what's that?
So is this part of what we're looking at, is this item that says this is the budget for 2025 that the person's gonna submit?
Uh-huh, yes. So our contract amount would be 70,000.
So this is the same school liaison that's going to all different counties? I'm trying to understand.
Yeah, she oversees the other counties' school programs. And then they collaborate on they have meetings for IU strategy and initiatives.
So are there additional personnel in these other counties that she's overseeing, or is she?
Yeah.
Okay,
So I don't, okay. So is that, I mean, I feel like is that our responsibility to cover costs for other counties? Not,
Well, I think that's one of the suggestions of redoing this contract so that we're funding very specific, like, core services.
for other counties?
No, for Monroe County,
Oh, for Monroe County.
right?
But if you look at all the schools just in Monroe County, that's a lot of work.
Sure,
Just right there. That's a
Sure.
lot. And so I think it's definitely a full-time position. I'm still unclear about where this person's job would end and if we created another committee with the health department to do that too. Do you have any idea? Probably you don't, but one of the things that you mentioned that they said in this survey, I forget which school it was. We want more help with education.
Yeah,
Do
so
you
I
have
need.
any idea what that means?
No, and I've sent out additional communications to the schools this week to try to get more information about like what are some of those areas, to get more clarification. So I'm waiting.
and at the first, I thought, so the form was submitted. You see, no, but then what exactly is the red?
I think they did not submit feedback.
Any of any kind?
So do you need a vote from us on the contract? Or do we?
I think it's just more of a discussion about kind of which way to go while we work on a new contract for the end of the year.
Well, I think we gotta make sure we're meeting all the health first core activities. That's pretty obvious.
so for instance, like this line item, fringe benefits, so you're saying maybe that includes insurance or something that's actually not approved by the funds? I'm trying to understand the details so we can, so who does the contract negotiation for? I mean, we have to approve the contract. So how is this different from our current contract? It's the same 70,000? Is that what they asked for last year?
That's what they asked for, but we provided 65,000.
Uh-huh. So do we need more of a breakdown of what they're covering for these amounts? For instance, salaries for how many employees and fringe benefits, what that means? and-
That's
no,
just one person.
That's just one.
Lisa.
Okay.
Do we know how many of the core services for Health First for schools we're currently meeting or not meeting?
Let's see. So, I can just give you a brief kind of overview here. So, for data that has been submitted for January through June of this year. So with screenings, the feedback I received from Lisa was that the schools, most of them had this established. And she was not directly involved in any of the screenings on site. Let's see. 231 students received tobacco and vaping cessation education. There are 16 schools that have evidence-based anti-bullying programs.
So
So
this, I'm sorry, so this sheet, these are the core services? Is that correct?
that's correct.
Okay,
Yeah.
thank you.
So the gaps, so the
and
ones that are blank.
The ones that are, that's what I'm trying to
Yeah.
understand. Okay, the ones that are blank,
Are ones.
we're
yeah.
not doing them. Thank you, thank you. Or at least they didn't get done January through June.
Yes.
Okay. So it looks like there's quite a few blank things here. It looks like roughly half the core services we have no report on. And maybe that's simply because we don't have data rather than we didn't do anything.
Yeah, I'm assuming that there was something done.
Yeah,
Well, there may have
But
been.
I know, but-
something We don't know.
But that's true. No, I understand that. We don't know, we're assuming. I'm not saying that's a good thing. I'm just saying we're assuming it's done.
So who would we get this additional data from? Who's the contact person?
Well, Lisa submitted this, yeah,
Okay.
so this is everything that she had from January to June, and then we'll do the next batch, July to December.
and does this basically look like what you have to put in the database for Health First?
Yes, numbers wise, and then you have to fill out like a description on every single one, so you have to do it singly.
Because I wonder if, so if you just look at the screenings one, so we've got 2 blanks there. What if, the ones that have zeros, there were no children who needed those services in the time period? That shouldn't reflect poorly on us. Is there a way to register that in the database?
Yes, so there's area where you can put in like
Okay.
feedback and,
Because it's possible then on this report where it's blank, it's blank, not because we didn't do anything, but because there wasn't a need for that in that time period.
Or the other question is Lisa fully aware of all of these areas and the expectation that all of these areas will be addressed?
I provided them with this template and the data at the beginning of the year of all of these core services. So she and the nurses have this information.
I'm having a hard time understanding how safe sleep relates to kids in school.
Yeah.
You know, that sounds,
Yeah.
that's
Kind of a moot point by the time they're that old. So.
Maybe the babysitting. I don't know.
no,
It seems like a weird one.
Well, here's what I think we need. We need, for the blank spaces, we need an explanation as to whether those services were not done. Or, as Aurora said, there was no need for that, no one required that service. Or if it's a service that's mandated and, was performed. Or should have been performed, or if it wasn't performed, why wasn't it?
Yeah, it seems like on the form, you'd almost need two columns here for, requested and provided.
I mean, Lisa seems like a very competent person in person, and
Yeah,
I
she
can't
is.
imagine that she would let these
Yes.
things slide and she wouldn't have data on this. I mean, when she did her presentation, I think it was like, well, everybody there kind of was wowed by everybody. I
Yeah,
think they did a
yeah.
great job. Okay, any other comments concerning the school liaison contract? Or as to whether we're going to explore having our own. I think we need answers to this.
Yeah, I would like a lot more information about what exactly that person would do. And why it's not currently being done by Lisa, or it can't be done. Before we think about making a decision.
I mean, by the comments that, some of the comments that George brought our attention to, it appears that a supplemental person might be needed, and if there's money to do it, providing that additional service wouldn't be a bad thing. But yeah, I just have to know.
and ultimately, does Lisa feel overwhelmed that she has too many schools to service and cannot do everything that is required? I mean,
That's
me, that's
another
part
good
of the question.
consideration. It
Yeah.
is part of the question.
Right?
So I think when when we have a better understanding of all of that, we'll be in a better position to.
Make a determination.
Okay. So, we'll move on to, new business.
Oh,
And we're gonna talk about the Futures Clinic audit. We have been notified by our funding agency that they have finally, we questioned why, when we passed with flying colors, when the audit was done, that they were requesting another audit. As it turns out, their explanation is that they finally finished reviewing all of the policies, and we are out of compliance because some of the policies are outdated and haven't been updated to the tune of roughly,
I don't remember.
yeah, a bunch of policies.
A lot.
Yeah, a lot. And it's not that we aren't following proper practices, it's just that these policies haven't been updated, and so that has triggered an additional audit. Now, our contract or our grant runs out in April, May, March, June.
We switch in October and then, so there's one, October and then the next one's, would start April.
Yeah. So they said they would take it would take place before March.
The re-audit needs to
Yes.
take place before March. So basically, the re-audit would be, we've corrected everything that they've told us to correct. We say we're ready for you to come review. They do a re-audit. That has to happen before March.
However, Lori thinks that there's a possibility because we have this October sort of
Switch.
switch that they might want to do before that, but we haven't had any notification of that.
I think she would have told us if
Yeah, I would.
October's only 6 weeks
And they
away.
specifically mentioned March.
Yeah,
so-
she specifically
Yeah.
mentioned.
So, anyway, we have that audit coming up, and it's no secret that, you know, the clinic has not been working at a level that we would like for it to be working. So we are diligently making some moves to bring that clinic into compliance. Any other
it
comments?
sounds like there are two different issues. One sounds like policy issue, updating all the policies, but also then personnel issue of making sure that we have personnel.
Well, for the re-audit, yes, they said staff up, you know, get your vacant
So both-
positions filled, which we're
Which is-
trying,
Yeah.
we've been trying.
Yeah.
And
And
As far as the audit goes, you're right, there are two components to this, or well, probably many
there probably
components.
be more.
Yeah, many components, but the two main things are staffing and the
Policies.
policies. So you are absolutely correct. But of course, that all adds up to the audit. So we're trying to get things
Moving.
moving. Yes,
Are
Thank
they
you.
working on the policies now, updating them?
they will be soon. They are not working right now. Okay, any other comments about I just wanted to make sure everybody knew that that the clinic is being audited by the granting agency.
And I'm assuming that the funding agency's policies, that we're basically out of compliance with their updated policies. Is that what we're saying?
I think it's a mix between, yes, them and then, at the federal level.
Yeah, the
Okay.
Title 10.
Okay,
Yeah.
so it's a matter of taking all of those pieces, putting it together and redoing our policies.
Yeah, I think
What I'm hearing?
most of these policies,
they.
I mean, they already exist.
You don't have to write anything from scratch. It's a
Yeah.
matter simply of looking at the policy that we have, looking at the
and pasting.
current version.
Yeah.
Making sure our matches and getting updated signatures and dates. So I think for, it shouldn't
That
be,
part should be pretty straightforward.
exactly,
Okay.
Yeah.
got it.
exactly.
That, yeah, even though it's a number of policies, that job is not as onerous as it sounds, so.
Yeah, exactly,
It's
exactly.
a cut and paste kind of thing.
Yeah.
Just takes somebody with a technical skill. I don't, when it comes to computers and word processing, but someone like Aurora could do it like in about 5 seconds, I think.
But she's not going,
Well, no, I'm not saying that, but I mean,
because it's not her
you
job.
possess those skills, but you possess those skills, and I'm jealous of that. Okay, number 2, under new business, approval to amend the senior EHS general position hours, on mental health.
Yes, so this is a request to move this position from 35 to 40 hours, based upon the additional workload that they're seeing with restarting the radon program. They're doing the tick programs, the mosquitoes. They're doing a lot of that work with the state and the state lab, in addition to all of their regular work, and in addition to providing that cross coverage in wastewater and assisting, and for this position to be able to help provide some backup coverage for Mike. So if things are, he's out in the field and someone can be here and vice versa.
And do I remember that we don't have to get this approved through council? That because we have the funding, we can authorize this up from 35 to 40 hours? Or does this all have to go back to council and beg?
I think it has to go to council. I don't think it has. to
We don't-
go
I
to
don't think,
Wes,
I don't think
though.
it's gonna be a
Yeah.
begging situation.
Oh, okay.
That the council has spoken favorably in the past. As long as there's some reasonable justification,
40
moving
hours.
employees from 35
Yeah.
to 40 hours.
Okay.
That they even question, when all this was instituted many years ago, they even questioned, why was this done initially? Because they're constantly faced with this all over county government, not just here. So, this doesn't have to go through a very lengthy process.
Probably when they put on the tax cap, all of this happened.
Well, so we need a motion to.
I move to amend the senior EHS general
Second.
position to 40 hours.
Okay, been moved and seconded to move the EAH general position to 35, from 35 to 40 hours. Any further discussion? All those in favor, please say aye. Opposed? Motion passes. All right. Great.
New employee contract.
Yes, so, the emergency preparedness coordinator positions, full-time position, we've been, going through recruitment for that, interviewing candidates. We have an internal candidate that we feel is the most qualified and the best fit for the position. The issue is the person does not meet the job qualifications for the degree requirement at this time. The individual is still finishing up school. So this request would be to be able to provide a conditional employment status, have basically just a legal document that's written that we will extend an offer for this position. But if for some reason the educational requirements are not met, then we could terminate the position.
And is there any time limit on finishing this degree or any of that? Is that part of a conditional agreement?
Yes, so that would be written in, and then at that anticipated graduation date, if that's not met, then I think we would revisit. Are we going to amend and extend, or are we going to maybe terminate at that time?
Depending on the circumstances. Motion?
I move to approve a new conditional agreement for employment.
I'll second.
Great. It's been moved and seconded. All those in favor, please say aye.
I,
Opposed? Great. I
Right on,
think that's it.
Good
Uh,
job. Look at this.
I have a motion to adjourn. Any board comments?
I have two quick comments.
Okay,
Friends of Lake Monroe invite people to tour the water treatment plant, City of Bloomington Utilities Water Treatment Plant, September 8th, 10 and noon. Visit their Friends of Lake Monroe website to register if you're interested. It's supposed to take 90 minutes and wear sturdy shoes. And I would also like to say that there's an effort underway to extend services and a way of dealing with the homeless in Bloomington. You may have seen in the Herald Times on, was it Monday or Tuesday? There was an article. In any case, agencies, and that includes Middle Way House, Heading Home, the Beacon, a number of agencies and the city are collaborating to try to develop a new approach to the unhoused, particularly the homeless on the streets. These folks require health services and they're badly underserved in many ways. And programs are being run. Last night, there was one for the city council inviting public comment to develop ideas for how the city council could adjust policies or adopt new procedures to help with the homeless situation. And Lori was there and a number of other folks, and some good ideas were generated. So watch this space. I guess that's the word.
My question is, how are they going to determine someone's origin or whether they came from this area or not?
That was one of the issues addressed, and it's very clear that people are being given bus tickets and told to head to Bloomington. And it's very likely that Bloomington may be giving people bus tickets and telling them to go home. And there are a lot of other approaches that will be needed to address things in a fair way, but clearly Monroe County residency is a big issue. And for a period of time or something like that. There are a lot of interesting questions that have arisen. Everything from making park, bath, restrooms available 24/7, 365, and possibly laying on security so that people would have access. A lot of different kinds of things that are nuts and bolts, but also some very general principles. So there are many things that can be considered. And I think Laura would probably second the sense that it's going to be a complex issue, but it's one that really needs to be addressed as a health issue.
It does.
Increasingly so.
Well, thanks, George.
Thank you, George.
Good. Anybody else have any comments? Seeing none, we have a motion for adjournment.
I so move.
Second, okay. All those in favor of adjournment, please say aye.
Hi, one of these days I'm gonna oppose, just for fun.
Then your meter will run out and you'll
I
be
know.
punished.
So we have a meeting.
We do,
We-
right now.
Oh, okay. And we
So
have
if you
one
can
in
unhook us from
As
everything,
well.
thank you.
Okay.
Don't have the